please be aware of that. And please, if you have questions, please use the Q&A function and put those in there, and we will have a set of short Q&A after each of our speakers. We have a really good lineup this afternoon, so as well as giving an introduction to the Chile Hub from Professor Pia Hardelid and Dejan Mumovic, who talk a bit about Chile itself. We have a recording from Professor Russell Viner, who is the Chief Scientific Advisor for the Department of Education. And then we have 3 speakers, Alice Handy, Michaela James and Matthew Clark, who will be talking on some very different perspectives around the work that has been carried out over the past few years around indoor environments for learning and health and environmental conditions. So without any further ado, I'm going to hand over to Pia, who is going to introduce Chile to you all. And over to you, Pia, and there'll be an opportunity. So if you've got questions, stick them in the Q&A and we will ask them after each of the talks.
Great, thank you ever so much, Kath, and welcome everyone to our inaugural seminar. Let me just share my slides. So can everyone see this? Hopefully you can see the slide. Everything is fine.
Yeah.
Amazing. So yes, as Kath said, I'm Professor Pia Hardelid. I am Professor of Epidemiology at UCL, Great Ormond Street Institute of Child Health. And I'm one of the co-directors of the Chile Hub, together with Professor Dejan Mumovic. Dejan is also on the call here today. And we are, Chile is one of the 7 realizing the health co-benefits of net zero hubs that were funded by UKRI, specifically MRC, EPSRC and NERC, together with NIHR. And we are the only hub that focuses on children's health. And given that the vast majority of the burden of climate change, the morbidity burden of climate change is expected to fall on children, I think it's, and as a child health researcher, I think our work is absolutely crucial. So my job today is to give you a bit of an introduction to the work that we'll be doing in Chile. So first of all, or can I just say, this is our beautiful logo, and it was co-designed by Year 4 students at Morrison Primary School in Swansea, and I just think it's amazing. So I hope you enjoy our logo. So this is our vision for Chile. So within Chile, we will maximise opportunities for health improvement for all children and young people as educational settings transition to net zero. So I just thought I'd give you a bit of more of a detailed background to why we have this mission, that we know that school buildings have to become more environmentally friendly and green, but how will that affect children's health, and how can we support schools and children and young people and families to really sort of realise the health benefits of that transition? So the school buildings in England, in the sort of broader context, are really in quite a poor state, as many of you know. So the Department for Education estimates that about 40% of school buildings in England are beyond their expected design life, and 8% of English pupils, so nearly 1 in 10, attend schools that DfE have assessed and deemed that they need major refurbishment to just ensure that children are safe in their school. And I think what's really sort of telling here about how much sort of the value of children in society is that since 2021 the Treasury has allocated 3.1 billion of annual capital funding for maintaining school buildings. So that seems like a lot of money, but actually what the National Audit Office recommends and what is required just to maintain school building standards at the same at the same sort of standard as they are now, we require £7 billion a year. And obviously, you know, schools have had less than half of that. So I think, you know, basically school buildings are you know, really poor states, and children's education sort of therefore is at risk. In terms of how schools fit into the climate change agenda, well, schools and nurseries make up around 15% of carbon emissions from public buildings in the UK. The way to sort of a traditional way of dealing with that is to, you know, to insulate schools and nurseries more, to make them more energy efficient. But that in turn then can lead to poorer indoor air quality if there's not sufficient ventilation, something that Kath has obviously done a huge amount of work on. Indoor air pollution can become trapped, and it can also make it extremely hot indoors, which is a huge problem. So, you know, I'm based in London. That would be a huge problem for schools in London, and some schools have had to shut during the summers because it's too hot. You know, these aren't just any old buildings. Schools and nurseries is where children develop, they learn, and, you know, they take exams. And these exams have a very, very strong bearing on the future income. So these are absolutely crucial environments for children and young people, and we may need to make them as safe and supportive of children's health as possible. But of course, we also need to make schools and nurseries more environmentally friendly. And really, in Chile, that's the sort of state that's the lay of the land, and that's where we're coming from. We know schools need a lot of investment to become better, schools and nurseries, and how can that investment to just, you know, to be maintained and to become more environmentally friendly, and how can we ensure that that investment is placed so that children's health and education is at the forefront of that, and also sort of making sure that that benefits all children and really reduces health inequalities. So this is our current team. This isn't even all of us, because we keep joining, people keep joining the Chile team over time as well. But yeah, as I said, it's led by myself and Dejan, so we're here in the middle. And we have great collaborators from London School of Hygiene and Tropical Medicine, Swansea University, University of Leeds, UK Health Security Agency, Imperial, and University of York. So that's where we are based, but we're very keen also to sort of grow our hub and collaborate with you all, hopefully. So what are we actually going to do? So we have 6 work packages within Chile, 4 sort of science research-based work packages, and then 2 cross-cutting work packages. So I'll just go through them now, and very happy to take questions later. So the first work package is called MAP, and it's led by Sani Dimitrilopoulou from UK Health Security Agency and Henry Burridge from Imperial College. And really, this work package is about trying to map the state of indoor air quality across schools in England and Wales. So there is a programme of building on the SAMI project, which Henry led together with Sarah West from University of York, where schools are sent low-cost indoor air quality monitors. And here we're growing that project to also include paired outdoor quality monitors to be able to monitor the sort of indoor-outdoor interface of air quality in schools. And then Sani is leading a programme of work to recruit 20 schools across England and Wales, representing different types of areas, rural, urban, different types of building designs for the school, different building ages, serving different types of populations, and to really do a very sort of deep dive into indoor air quality in schools, measuring all sorts of pollutants in the indoor environment as well as noise. And then that will be paired together with national school buildings data that exists for England and has just been collected for Wales, and to be able to sort of improve those sort of national databases. So these are national data on all school buildings across England and Wales. And then for work package 2, which I lead together with Professor Rich Fry in Swansea University, he's actually in the other meeting I'm currently at, so he couldn't be in the seminar here today. But here we are using that data on school building characteristics, and linking that to individual level health and education data for children across all of England and Wales, to really understand the most important aspects of the school indoor environments and school buildings that are most strongly associated with children's health, and also for which children, you know, we are there certain groups of children who are particularly vulnerable, that particularly need to sort of ensure that their school environment is healthy for them. Then that epidemiological work will feed into a modelling work package led by Mike Davies at UCL and James Milner from London School of Hygiene and Tropical Medicine, where they will model sort of various interventions for school buildings to make them more energy efficient, and look at the impact on health and education for children using national school building models. And then there is a work package called Evaluate and Test, which is led by Douglas Booker from Leeds and Anna Mavrogianni from UCL. So that is really trying to sort of work to evaluate existing interventions and co-develop new interventions. So the first aspect of that is to do further evaluation of the HEPA Act trial that Kath led to install HEPA filters in schools. And so Doug and Kath will be looking at sort of a broader health outcomes, health effects of that, and also thinking about it as a complex intervention. So carrying out qualitative work with school staff to sort of see, you know, the processes, and, you know, having a sort of broader evaluation of, you know, the use of HEPA filters in schools. And then Anna Mavrogianni will do co-develop interventions with children and young people to sort of, she will map temperature within schools in the winter and summer, and then co-develop interventions with children and young people to kind of make themselves more comfortable within the sort of indoor environment in terms of the temperature. And then we have, I said, there's two cross-cutting work packages. One is Involve, and so that's involving children and young people and schools in our work, and that's led by Sarah West from University of York and Michaela James from Swansea University, who you will hear from later today. And it's really, you know, across all of our work packages and across all our work, we want to involve children and young people. And even when we were writing the grant, Dejan and I went meant to meet some children and young people to chat about our ideas. So, you know, we're none of this will matter unless, you know, we work with children and young people to suggest things that are meaningful to them and that they think can work in their school environments. And then finally, the work package that's led by Dejan and Kath again, which is engaging with stakeholders. And you will hear from Russell, who led Russell Viner, former Chief Scientific Advisor at Department for Education, and then Matt Clark from Hertfordshire County Council today. So, you know, we work very closely with stakeholders to ensure that we can have impact from all of our research as well. And so, you know, I'm a big data nerd, and we are really sort of building within Chile. We're so proud of all the data that we're using, and we're really building on data infrastructure investments by Administrative Data Research UK and Health Data Research UK into national flagship data sets, our Kids Environment and Health Cohort and eChild, and also into the SAIL Data Bank in Wales, Connected Bradford, and the HAPPEN and the School Health Research Network again in Wales, that Michaela will tell you more about HAPPEN in her presentation, but also building on SAMI that, as I said, Henry Burridge led, which is, you know, a huge programme of monitoring school indoor air quality using low-cost monitors, which Alice will talk about later. And these are some of her partners, both, you know, sort of organisations, charities, and local and central government that we're very delighted to be working with. And this is our, like I said, our beautiful co-designed logo, and this is QR code from our website. And thank you. That was all I was going to talk about. Well, we are very keen to connect with you all, and we're absolutely delighted that you're here today. Thank you very much.
That is brilliant. Thank you very much, Pia, for the intro to Chile, and I think it's fair to say I think we're all really excited to be working on this. I can't see anything in the Q&A, but if anyone does have any questions for Pia, please just post them into the Q&A now, and otherwise we will look to move on. I can't see anything in there yet. If you have questions for the speakers, if you can post them as we go, then they're ready for us to pick up at the end of each speaker. I'm going to move on, and I'm going to go to our next talk, which is from Russell Viner, who's the former Chief Scientific Advisor who's the outgoing Chief Scientific Advisor at the Department for Education. Unfortunately, Russell can't be with us, so we have a recording, and of course this is where I have to test the tech and hope that this delivers properly for us. But I'm hoping you will be able to see and hear Russell's talk in just a moment. So that is showing for you. And if I press play, I hope you'll be able to hear it too.
Hello, I'm Russell Viner, and I'm really pleased to be able to support Pia and Dejan and the Chile team in this important research. I'm so sorry I can't be with you today, but unfortunately I'm not in the country at the time you're having the seminar. I was until very recently the Chief Scientific Advisor, or CSA, at the Department for Education. And I was really pleased to see this work in gestation, to talk to Pia about it, and I was overjoyed to see it funded, and it's great to see it starting. I've now left the DFE as CSA, so I can't speak for the department, but I know that my successor, Professor Michael Thomas, and the department's science team are really supportive of this work going forward. Ensuring that our children learn in healthy environments is becoming a real priority for education departments in many countries, and ours in England is no different. It's clearly a priority. I think we're increasingly realizing the interconnection of indoor environments with children's ability to learn and with their health and well-being. And related to this, the rising challenges that climate change and pollution pose for each of these issues. Many of the great challenges that are right at the front of our ministers' minds, such as the attendance crisis, such as issues with rising mental health problems, rising spending on SEND, special educational needs and disability, each of these relate to indoor school environments, and each of these need further research, and each of these will be important for findings from Chile to feed into. In terms of attendance, the COVID pandemic reminded us hugely that ventilation is so important for infection control, and there's evidence from randomized controlled trials that cleaning air reduces absence due to respiratory infections. So ventilation is clearly very much on people's agendas. Yet we have a very complex school estate in England, with both brilliant new sustainable schools and a lot of very old school buildings, some of which have been poorly maintained. Aside from ventilation, heating, indoor air pollution, multiple elements of the indoor environment are hugely important and need to be further explored and discussed and researched as we both build new school buildings and maintain old ones. So I've no doubt that the work planned in Chile will be an important contribution to knowledge and will be highly influential amongst policymakers. Pia asked me to speak briefly on the way that DFE uses science and evidence. Implementing evidence-based policy is a clear ambition of the Department for Education. And I would say I haven't yet met a minister or senior civil servant who wasn't really strongly supportive of this. But we scientists do have to recognize that science and evidence are only one part of how decisions are made by politicians. Economics and politics are the two other main elements, and they are often as powerful and sometimes more important than science and evidence in guiding decisions. As a science advisor, you're always very conscious that in the British system, and I think very rightfully so, science advise and ministers decide. The Department for Education has dramatically expanded its capacity in science and evidence over the last 3 years, with a tripling of spending on research gained in the last multi-year spending review. It's something we were very pleased about. This has been accompanied by an increase in the capacity of the science system, including setting up a science advisory council and a range of other structures, and improving governance and research commissioning. My successor as CSA, Michael Thomas, is really now very well situated to ensure that science and evidence are at the heart of policy making in the Department for Education. And I'm particularly pleased to be able to say that the school estate, that's how we build, how we run, ventilate and heat and sustain and maintain schools, is a major focus of DFE's research plans over the next 4 years. And that's both the outdoor and the built environments and indoor environments. But indoor environments will be an important part of this. And I think this means that the findings from Chile will have ready receptor sites in the science and evidence sides of DFE, but also in the policy making elements of the department. Look, I'll finish there. I'm very sorry to miss the rest of what promises to be a very engaging seminar. I wish you all well, and sorry I couldn't be with you. Thank you.
Okay, so obviously we cannot ask Russell questions, but it was really, really good to see that how seriously the Department for Education are thinking about the science and evidence in this space for us. I'm going to move on now to our next speaker, who is going to speak live. So we would like to introduce to you Dr. Alice Handy from Imperial College. Alice is one of the researchers involved in Chile and also was previously involved with the SAMI project. She's going to talk about her work around comparing PM 2.5 concentrations in collected indoor environments and with outdoor concentrations collected from background data. So over to you, Alice, if you want to share your screen, and hopefully everything works.
Is that coming through?
Yep, that's perfect.
Brilliant. Well, thank you very much for the introduction and the invitation to speak today. Yes, as Katha said, I'm going to be talking about some work we did in the SAMI project, particularly looking at particulate matter. SAMI stands for Schools Air Quality Monitoring for Health and Education. And the SAMI method is a novel approach to monitoring air quality at scale, grounded in citizen science. Participating schools receive a free air quality monitor and guidance with how to connect it to their Wi-Fi network, at which point the monitor will start recording air quality data, which we as researchers can see. But more importantly, in some ways, schools can see via visualizations on a custom co-designed web app. There are also a set of activities that have been specifically designed to help schools learn about air quality. So schools are not only able to visualize their data, but they're empowered to understand what they can do to improve their air quality as well. This is a photo of one of the air gradient 1 monitors we use, which measure minute by minute measurements of these 5 metrics. Since the project started in 2022, over 1,300 schools have been recruited to SAMI, and we've got good quality data from over 900 of these, which has led us to have the UK's largest schools air quality data set. We've continually developed the web app and seen good engagement both in the people signing in and the people doing activities. And over the period, we've been creating a wealth of publicly available resources specifically tailored for schools and communities to communicate about air quality. And of course, we've produced some research outputs as well. One example early on was we posed the question, are UK schools well ventilated? And my colleague Sam Wood led some analysis into the CO2 data that we've collected from these monitors, and found that classroom CO2 correlates with outdoor temperature when outdoor temperatures are low, windows seem to be closed, and classrooms are poorly ventilated. Interestingly, most classrooms did actually adhere to the BB101 CO2 guidelines, but when we inferred ventilation rates from those CO2 levels, per person ventilation rates were poor. When the inter-school factors were investigated, we found that controlling for outdoor temperature, more deprived schools actually had higher CO2. You can read more about it in this publication. Today I'll focus more on the particulate matter data analysis we've done. So this research looked at the academic year of 2023 to 2024. Over this period, 490 schools met our data completeness criteria, and those the locations of these schools are on this map. We know that outdoor air can be a significant source of PM for schools, and so at the time we weren't measuring outside at schools, so we used DEFRA's AURN data to give us an idea of the outdoor PM 2.5 levels. For this analysis, I've averaged over all of the schools every day and will refer to that as the SAMI PM 2.5 concentration, and average over all of these AURN sites and refer to that as the AURN PM 2.5 concentration. So here we have the concentration on every school day over the year. The mean value is shown by the dots, and the interquartile range shown by the bars in red for the schools and blue for over the sites. For most of the school days, the ambient outdoor concentration measured at AURN sites is higher than those measured by the SAMI monitors. But we see this very close correlation between the two, a significant correlation of 0.77. SAMI monitors don't just measure during school days, they measure continuously for as long as they're plugged in. So we can also look at the 24-hour day data on every day throughout that period, so including weekends, school holidays. And even when we include the times that pupils are not at school, we still see this strong correlation between the SAMI and AURN data. This is true even on days when schools are closed, and we expect their ventilation openings to be closed, which may indicate that schools are permeable to PM 2.5 even when they're closed. It's worth also highlighting that this data is the average of schools across the UK and AURN sites across the UK. So this correlation is a trend we're seeing on a national scale. Added to this plot now are horizontal blue dashed and red dashed lines, which show the mean of all the data across the year corresponding to the SAMI and AURN in red and blue respectively. Interestingly, when we look at the difference between these means in the 24-hour data and the school day data, we see that the difference is approximately 1.12 micrograms per meter cubed, different when we look at the 24-hour data to the school day data. And this is a result that would have been attained if all else remained equal, that during school hours, the reduction of PM 2.5 indoors was sufficient to increase the concentration by 1.12 micrograms per meter cubed. Considering in schools the year average is 4.54, we can infer that sources within schools might account for up to 25% of the concentration. Or alternatively, outdoor air contributes to at least 75% of classroom concentration. We next focused on the impact of these very elevated outdoor concentrations and looked to the health-based guidance that the WHO publish, saying that 24-hour mean concentrations should not exceed 50 micrograms per meter cubed. We then defined an outdoor WHO event as any day that the AURN concentration exceeded this threshold, and asked, do we detect these in schools? Imposed on the graph now a green band which show when these outdoor WHO events occurred. We can see in the 24-hour data that in schools the PM concentration did rise. We can also ask if they're detected just when people are at school by examining the school day data, and we can see these outdoor WHO events did lead to elevated concentrations in schools. Throughout the year, the outdoor concentration was elevated frequently, but not as high as the threshold of 50 micrograms per meter cubed all the time. So we also considered what we called moderate events of a lower threshold of the median plus 1 standard deviation of the ARN 24-hour concentrations over the year, and defined a moderate event as any day that the 24-hour exceeded this, and those are now presented in the darker green bands. When we look at the 24-hour data, some moderate outdoor events led to elevated concentrations in schools. Many of these moderate events occurred when schools were closed, and some of them led to elevated concentrations during school hours. Due to the relatively long amount of time that children spend in school, the dose or exposure they receive at school can be important. In fact, after the home, the school is an indoor environment in which children spend the most time. So we estimated the potential dose received over the school year as the time integral of the inhalation rate multiplied by a minutely concentration averaged across all schools. And we looked at this on every school day across the year. This figure shows the contributions to the total dose from the different 1 microgram per meter cubed concentration bins. And you can see that most of the dose is due to periods when the concentration is quite low, but there's this very significant proportion that occurs when the concentrations are greater than 15 micrograms per meter cubed. We also estimated just the dose that was just received during these events as we define them, and we've superimposed that on the graph here. Interestingly, not surprisingly, most of the events occurred during these very high PM periods, but there's also some high PM periods that occur in schools that aren't picked up by the that don't occur during events. If we think about the total proportion of the dose received over the year that is received from events, we can see on this graph. So the grey bar shows the total dose over every school day, and then superimposed on top of that is stacked the WHO events and the moderate events. These events together account for about 41% of the total dose over the year, which is significant because the events only occurred on 13% of the school days. So just to sum up some of these findings, we found that outdoor air is a very significant source of PM in classrooms, contributing to at least 75%. Whilst the long-term exposure of the school year is predominantly due to low concentration days, outdoor PM events contribute significantly. And this is important because we also looked at the climatic conditions in which these events typically occur. And they typically occur during the part of the year that children are at school, rather than the summer holidays when they're not. And you can read more about it here. As I'm sure you won't be surprised to hear, this is just one of our many research questions. Something else we've been looking at recently, and some work led by Sam, is looking at the impact of HEPA filters in a project with Herts County Council. And some initial analysis has revealed that approximately 27% a reduction in classroom PM. We've been very lucky that now we've got this fantastic air quality data set. We can use data-driven methods to analyse it. So we recently applied robust principal component analysis to both our PM and CO2 data, which extracts the main source of variation in the data set. And for particulate matter, we see the main variation is temporal, which is we expect driven by the outdoor variations in outdoor PM 2.5. But for CO2, the main variation in our schools is inter-school differences. And the key thing here is because CO2 is an indoor source. And I think this might be the first piece of work published since, under CHILI funding, which is nice and exciting. I'm very excited about CHILI, particularly we are going to be doing some monitoring at schools, so we'll have outdoor at schools, we'll have a greater level of detail. And as it's already been highlighted, we're very excited to link this air quality data to understanding the effect of classroom temperatures, school buildings, and children's health as well. So I'll just finish by saying many thanks to the SAMI Consortium, and a particular thanks to all the schools, the pupils, and the teachers who have made this research possible. And I welcome any questions.
That's brilliant. Thank you, Alice. And nice to see that we can attribute a publication to Chile already, which is excellent. I, I'm just looking to see whether we've got anything in the Q&A. So please do put your questions in the Q&A bit of the seminar. I did have a question, Alice. So you touched on, you sort of indicated that there are some indoor sources and you can see that in the mean. And I guess you can look at the variability in that as well to some extent. I wonder whether there's anything you can do to understand the sources. I mean, I guess you're limited by the fact you've only got the one monitor in most of the schools, but whether you see certain times of day or certain classrooms, if you know which classrooms they're in, that are more or less likely to result in sources, or whether it's just general human activity.
It's a fantastic question and something we'd really love to know the answer to. I think, as you've highlighted, we have one monitor per school, and part of the deployment of SAMI and why we've got so many monitors across the country is because it's this remote deployment. We send the monitors to schools, so we have limited understanding of where the monitors are within the schools, which can be difficult to answer some of these questions. As you've identified, one way to look at it is look at those profiles over the school day, and we've started to look into those. So keep posted for any results on that. But it's I think what will be quite exciting is if we can get the data in Chile from the outdoor monitors. It might be even easier to pinpoint that daily variation and whether that daily variation is coming from outside or inside, because that's one of the limitations so far, is having these the data from AUR end stations, which are quite far from schools. We're definitely picking up regional outdoor trends, but whether there are more local trends to the school, we can't say just yet.
That's great, thank you, Alice. And there's a question I can see from Laura in the chat, which says, what has caused the outdoor PM events?
Catherine, would you mind just adding, basically for the Chile audience, as the part of the Chile, we have also planned monitoring 20 schools in details.
Yes.
And that is going to be very detailed per classroom. So the questions that basically you have been asking Alice, these data are going to be complementary. So in few years' time, we will be able to answer these kind of questions.
I agree, Dejan, and we'll be able to compare that detailed monitoring to the simpler monitoring within SAMI. So I've got a couple more questions I'm going to ask you, Alice, before we move on. So one is from Laura, which is, what has caused outdoor PM events?
Great question. So we looked at air mass back trajectory analysis, which basically looks at where air masses that arrived to UK have originated from. And we looked at this data from the entire year and then just when the outdoor events occurred. And typically, particularly with those WHO events where the levels are particularly elevated, we see air masses arriving from North Europe, whereas most of the time for the UK, our air masses arrive from over the Atlantic. And so it's typical that these events coincide with when we get more air masses coming from Europe, which might be carrying pollution, or when we have slow moving air masses over the UK, and so pollution is allowed to accumulate in the atmosphere above the UK. And shall I answer the next question in the chat as well?
Yes, do you want to? So that, yeah, the next question from Amanda is, do schools choose where to put their monitors, and might there be any perverse incentives to place them in particular spaces?
So we advise schools to place them in classrooms at breathing height, so that's most representative of what people are inhaling, away from windows and doors, so that the data is not affected by those airflows, and then it's up to them really, but probably in a place that's not going to be disturbed. From the feedback we've got, we haven't heard that much tampering has gone on with them, and yeah, I think mainly people keep them out of the way.
That's great, thank you. Actually, there's a couple more questions coming in the Q&A now, so I'm just going to ask from Kate, do you have enough numbers to distinguish the size of correlation between different construction types? So for different schools and Have you looked at that at all?
That's a piece of work that we're trying to look at in Chile, actually. So some work we're trying to look at now. We have some limited data that's already publicly available about construction type, but really it's hard to say. So linking with these fantastic data sets that the different researchers in Chile have and Dejan's group in UCL have will enable us to do that analysis.
That's great. And one more last question from Kira, which is, I like what you did evaluating the dose of PM 2.5 over the year. Do you know if any studies have interpreted the dose into some sort of health impact, or do you have any plans to do that?
There's a wealth of research that have done many different things. We haven't done it specifically. And I think it can be quite tricky to link it in a non kind of clinical way or in a study like ours. But big picture, Chile is hoping to do that, is to think about the health implications.
That's great. Thank you, Alice. I'm going to have to move on now, but thank you for the presentation and for answering a whole bunch of questions there. I'm going to introduce our next speaker, who is Dr. Michaela James from the University of Swansea. Michaela is part of the Chile team, and she's going to talk to us about HAPPEN data and understanding wellbeing in schools to guide better learning environments. So, Michaela, if we've got you on there, can you can I see Michaela in here? Right, I can't see Michaela.
Michaela was certainly on here before.
She was, yes. I saw Michaela.
Oh, Michaela is here.
Have I got you there, Michaela? Just wondering whether you are inadvertently muted in some way.
Hi there, sorry,
Hi.
I couldn't access the unmuting button, but I'm here now.
But you're there now, brilliant. I thought you
now.
might have been stuck somewhere. I was just trying to find you, but
I was stuck, but hi, I'm here now, so no stress. So hopefully you can all see my slides now.
brilliant. Thank you,
But
Michaela.
thank you so much for introducing me, Catherine. So I'm Dr. Michaela James. I'm a research officer at Swansea University. So my research topic is around children's health and wellbeing. I specialise primarily in physical activity and play, but I cover the broad range of health and wellbeing. So I manage HAPPEN Wales, which is a pan-Wales primary school cohort of over 50,000 children in Wales. So I'm going to deviate slightly in terms of topic from talking about air quality and those sorts of indicators, now talking more broadly about health and wellbeing and health and wellbeing outcomes in children. So HAPPEN has been co-developed. So HAPPEN exists because we had conversations with head teachers. So we had conversations back in 2014 with head teachers across Wales who told us that they felt overburdened by health and wellbeing initiatives, that there was going to be a move towards prioritising health and wellbeing in schools, but they felt like there was not much support individually for schools, and that actually a whole host of intervention menu items were being chucked at schools, and schools just did not know where best placed to put their efforts and their time. With that being said, head teachers knew that they had to do something, but they really wanted this kind of way of being able to match up research and match up practice. So this is where HAPPEN came in, really, so that we were able to develop a tool that schools could use in everyday school life, so that we could then make individual changes or help schools make individual changes that would benefit their own pupils' health and wellbeing. So we've developed this collaborative approach that helps us improve that. So for those that are on the call that are not from Wales, to give you a bit of context, the curriculum for Wales was rolled out in September 2022. So in Wales, we have a slightly different curriculum. What we've done, instead of having siloed subject areas, we now have 4 kind of areas. Well, we have 6 areas of learning experience, I should say. And in those 6 areas of learning experience, health and wellbeing is one of the key components or the key focuses. When I went to a consultation event around the curriculum for Wales, they described this really nicely by saying that health and wellbeing is now this golden thread that's woven into the curriculum. So that means that there's a lot of emphasis on it, and it's placing physical health and development, mental health and emotional and social well-being as core components of what we're doing in schools, and being able to nurture children to be able to grow up as being very, well-rounded young people with good health and good well-being, and also not just being able to put that to display that, but also having a really good understanding of what that means for themselves, and not just for themselves but their peers and their community as well. So we were able to adapt that. So listening to those head teachers, we were then able to kind of look at this emerging curriculum for Wales, and then being able to adapt what we do to be able to meet better meet the needs of what schools needed at the time. So we have this now happen model. So to run you through it very briefly, what we have is a school-based survey that can be completed online. The survey is targeted at years 4, 5 and 6, so pupils aged 7 to 11. And we've done some piloting with year 3 as well. So we have this online health and wellbeing survey that collects a typical range of health behaviours. So things like physical activity, nutrition, sleep, wellbeing, safety and the local area. And these survey questions have been developed alongside pupils, alongside teachers, alongside key stakeholders, so that we're capturing exactly what we want to know on what we want to do better, not just from kind of a teacher level or a school level, but also from what do young people want to know about their health, and also what do Welsh Government want to know about people's health, and how can we then work together in this more collaborative approach so that we can then better children's health and wellbeing. So that survey is hosted online, and schools can complete it at any point during the academic year. We acknowledge that, through this co-design process, that schools are incredibly busy, and sometimes launching something just in a September period is actually not the best. So we've given that autonomy over to schools so that they can complete the survey at a time that best suits them and their pupils. So once they've completed that survey, they give us a nudge and they say that we're done, and then we produce this school level report that's tailored specifically to the curriculum for Wales. The schools get back this report, and it presents school level average results compared to national averages. So it allows schools to identify and prioritise aspects within the school report that they might want to work on, or they also might want to celebrate. So, for example, we've had schools notice that their active travel isn't great, so they've implemented active travel interventions. We've had schools cluster together and work in clusters, and understand that some of their cluster partners might have really good bits that they can help then do some kind of peer-to-peer cluster working to help improve that across the area, and that they can do some sharing within that to understand what's good practice, what's not so good practice, but essentially being able to really empower schools with what they can do to make a difference to their pupils' health and wellbeing. And like I said, that report is aligned with the health and wellbeing area of learning experience. So, teachers can draw really explicit links between what we've reported on and what they can then do. What this then gives us are these kind of way of empowering schools and giving data back to schools, but it also gives us this incredible cohort to do lots of amazing research, and it gives us this ability to work with the SAIL data bank to do some linked analysis, but it also allows us to do some really great stuff outside of SAIL and do some more localized stuff where we can really look at the health and well-being of children and young people. So to put this into a kind of a visual representation of what Happen does. So we have this kind of feedback loop. So this is how it works year to year. So what we'll do is we'll spend some time towards the end of the academic year throughout the summer looking at what are the research priorities. So what are upcoming priorities, what was going to be on the agenda for pupils, for schools and for wider stakeholders. So to give you one example of this, 2 years ago, Welsh Government introduced a 20-mile-an-hour speed limit in most community areas, and we saw a really great opportunity to ask pupils what they thought of this 20-mile-an-hour speed limit and be able to have children's voice implemented into that work, so that we could really feed that back into any evaluation going on. And we've also been able to do this with the free school meal rollout that's currently ongoing in Wales, so that we're able to identify these priorities, but then also be able to take a really unique and novel opportunity to have pupil voice embedded in that, so that we can ask children and young people what these more national national level interventions or policies are doing for their health and well-being. So we identify these research priorities. We're then able to co-produce the survey, so we can add in questions, we can remove questions, we can tweak and tailor questions so that the wording is really really accessible. We then open up the survey, we have that feedback findings via the report. We're then able to build this fantastic e-cohort, so we have this cohort for analysis, and then we're able to do larger scale research and evaluation, and then that leads into identifying the research priorities. So we're able to then do that not just so that we're asking the right questions, but also so we're answering the right questions as well. So we're able to, answer what's a real hot topic for those that can make a difference to children's health and well-being. So the sort of priorities that we've had, we've been able to look at outdoor learning, we've been able to do evaluations of the Daily Mile, we've been able to look at and do a rapid response to the COVID-19 pandemic, where we were able to look at pupils' voice in that, we were able to look at teacher voice in that, and we were able to feed into some really great research around the perceptions of that in a school and the return to school. We've been able to look at how afternoon breaks affect children's health and well-being, making them fitter and things like that. And we've also been able to, again, give real weight to children's voices when they talk about their well-being and ways that their well-being can be improved. So this is one of our most recent pieces of research. So being able to look at this fantastic cohort that we have and being able to do some longitudinal analysis. So we did some work into looking at health and wellbeing outcomes across Wales from 2014 to 2022. So we were able to use nearly 40,000 responses, which had quite a good breakdown in gender and was quite representative of Wales as a population. In terms of our key findings from that, we saw that, so I'm just moving the bar because it can't see. So we saw that there was a decline in physical health between 2014 and 2022. So things like the reduced ability to swim and cycle has been a significant factor for children in Wales. Unhealthy eating habits, such as decreased fruit and vegetable consumption and the increased consumption of sugary snacks, has become more prevalent. We've seen an increase in mental health issues, so including emotional and behavioural difficulties have increased, with emotional difficulties used to affect around 13 to 15% in 2017 to 2018, but in our most recent data we're looking at around 29%, so that's almost doubled. And moreover, indicators of well-being, autonomy and competence have also declined as well. So what does this mean? So we are seeing quite a continued decline of children's health and well-being, and this decline has been through the COVID recovery period as well. So what we'd like to flag is that even though COVID might have provided some acceleration routes for some of those declines, that actually those trends were there before and after COVID, and that we cannot just assume that children's health and well-being will get better without targeted intervention or policy focus. So in terms of happen going forward, what are our priorities? So for, we're looking at these wider collaborations. So we're really fortunate to be involved in Chile. So I'm co-leading Work Package 5 with Sarah West from York. So we're able to provide some expertise in that youth advocacy, co-production, and also school recruitment in Wales. We're responding to lots of calls around screen time impacts on health and wellbeing, and looking at what are the impacts of screen time on health and wellbeing in children and young people. Where are they consuming most of their screen time? What are they consuming in their screen time? So we're not just building up a picture of what that screen time is, but we're looking at what that screen time actually looks like. Being able to focus more on additional learning needs, and what do those that have been diagnosed with additional learning needs, what do they need for support for good well-being. We want to look at healthy relationships. So what do healthy relationships mean to children and young people? We're also developing a similar model, but for nursery settings as well, and just continuing that longitudinal data set for wider analysis as well. So building that cohort so that lots of people can be involved and use happen data wider than just our research team as well. And then, my areas of expertise is play, so I'm always interested in play, but we want to look more at afternoon break and afternoon break provision, because it's something that we have noticed within our data that is currently consistently being removed in schools for various reasons, catch-up learning, and also as a behaviour management mechanism. So we want to look at the impacts of afternoon break on health and wellbeing too. But our key kind of priority going forward, and always has been, is around empowering schools to make changes to their health and wellbeing to meet the needs of their pupils. So I say it all the time, but in terms of what our aims and objectives are, we're always about empowering schools first. That's our key priority. And then anything that comes in under that is just a secondary bonus for us. So thank you so much for the opportunity today. And if there are any questions, I'd be happy to take them.
That's great. Thank you ever so much, Michaela. And really fascinating to see what you've got in there, although some quite concerning things as well that you find. There's a question in the chat from James. Is it possible to share the questions you ask in the survey, or are they accessible online anywhere?
Yeah, absolutely. I can share. So I can share the questions. 100%. Yes, that's just a yes.
Brilliant. Okay, that's great to hear. And I mean, I just wondered about how easy it is to engage with schools for that survey. Do you find that some schools respond very effectively, others are a bit harder to reach, and other things you do to try and make sure you get a representative sample?
Yeah, absolutely. So one of the key things we noticed when happened was a much smaller scale infrastructure was that we'd often have the most engaged schools take part, and that would often then give us a sample that was not very representative of Wales. So very engaged schools from less deprived areas that had very well invested parents and things like that. So when we looked to do the rollout, it was really important that we kind of tried to make sure that the message that we were communicating was that it was a really valuable tool for schools, and it's not a surveillance mechanism. We're not looking at collecting data so that we can make league tables or do any comparison, that it's very much around empowering the individual school and not looking at. So for us, it was around changing the wording and the way that we communicate that, so that schools saw the benefit everywhere. So, you know, we're saying that again, you know, we're not looking at giving you a slap on the wrist for doing anything good or bad. What we're looking at is trying to give you the tools so that you can make those individualized changes to health and well-being. So that was probably one of the biggest things, was that the way of articulating what we're doing. So that helped with the recruitment.
Yeah, that's great. And I'm right in thinking from your what you presented that you every year you think about how you change your questions to be able to ask new things while still collecting your baseline data. That's right, is it?
Yeah, that's 100% correct. So every year we'll kind of have a new research priority, so that will get embedded into the survey. So in September 2025, at the start of this academic year, we looked at tweaking some of our screen time questions so that we're not just asking how much, but we started to ask questions around, well, what are you doing on your screens, and what sort of content are you accessing, and where is that screen time most taking place? Is that at school or home? So we're able to kind of tweak those questions, but also without kind of overburdening the survey, so it just doesn't become one massive long survey, so that it always remains relevant. So we're able to work with everyone that needs to be worked with to make sure that it stays concise, but also captures everything that we need.
That's brilliant. Really, yeah, really interesting to see what you've got there. So yeah, thank you. It looks like we don't have anything else in the questions at the moment. Oh, hang on. These jumps, they create things in there. Okay, I've got one. From Laura, are you planning to explore relationships between health and well-being with indoor air quality and overheating? And will the CHILI Hub be able to use your survey data to explore this sort of thing?
The simple answer to that is yes.
Yeah.
Absolutely. So being on board with the CHILI means that we can give the work packages that need to the relevant data from Happen. So I know that Rich and Pia will be able to do some work with that, and I know that Pia mentioned it in her presentation earlier as well. So yes, absolutely. Yeah, and that's exactly what we've got. That why Happen exists, and we make sure that it's accessible in sailors, because we want people to use the data, and we want people to be able to do it in ways that not necessarily that we've thought of, but also to kind of influence lots of different research topics and themes.
That's great. Thank you, Michaela. I think we can move on now to our last speaker of this afternoon. So I'd like to introduce Matt Clark from Hertfordshire County Council, who was going to talk to us about their experience of interventions in schools, particularly putting HEPA filters in primary school, and how partnering with researchers has really helped them to make the case for this investment. So over to you, Matt.
Thank you, Kath. Thanks very much. Can someone give me a shout out to say if you can see?
You're all good.
Slide. We're all good. Super. Thanks very much. So I'm Matt, and I'm a local authority person. So come with a different set of challenges to the academic sphere, but also a different set of opportunities. And my experience of working in air quality realm for now 15, 16 years in a local authority role has been that as time has moved forwards, the ability to do things as an individual in a local authority or as a local authority in-house have reduced as we've had very, very significant resource pressures. But that seems to have engendered the ability and the rationale for folks to want to go out and seek partnerships and work more widely. And I'm very happy to say that here in Hertfordshire, we've got lots of partnerships with academic institutions and research projects that are going on across the country. CHILI is one of them. I was asked to pick up on a couple of specific things, so I'm going to name them now. And then if I get to the end and I haven't answered them, you can all query me and shout at me and say, you didn't answer this bit of the ask. So the first point was to talk about or talk to the importance of clean air in schools. The second was why here in Hertfordshire we have taken steps forward in this area. And finally, how we have worked collaboratively. So if I haven't answered those three things for you at the end, you can shout at me. And then I'm going to instantly say, I'm not going to cover the first one much. Alice has beautifully summed up really why we should be interested in terms of air quality in school spaces. We know that children, the younger the child, particularly, they are more at risk to health harms that they carry throughout their life, and then the epigenetic effect after their life continues. So schools are a place where we know children are spending 70% of their time, and with of that, 30% of their time in the school environment, of their total time, and within of that time, most of it's in the classroom. So they're indoors. So indoor areas are really key. So we need to do things, and indoors is key. Children are really key. There's other more at-risk groups, but the legislative regime that local authorities are working to maybe isn't keeping pace, I would suggest. So I'm going to give you that backdrop first and then tell you how we've overcome that to keep on doing good things. So in Hertfordshire, we've got 10 districts and boroughs, and I'm a county council person. In 2018, 31 air quality management areas that exceed the legal limits. As of now, there's about 14 left, and over the next 6 months, we're going to see a load more go. Over the next couple of years, we're going to see the majority of them go. In theory, this could suggest that there's no need for us to be taking forward any statutory duty around this in terms of the local air quality management regime. And you can see the trace here. You can see my cursor. 40 is the magic number, and this is the average pollution concentration in Hertfordshire over years, based on the average of all the monitoring that's out there, hundreds of tubes. So we can see that the legislative regime isn't really giving us the shove we need to keep moving forwards. If we look at particulates, even though we've had that push forwards in the environmental improvement plan last year to say we're going to be trying to hit 10 micrograms an annual average everywhere by 2030 rather than 2040, here in Hertfordshire, most of our monitoring showing we're below that already. And sorry, the years aren't there. That number 6 is 2023, just for information. And it's still going in the right direction, I'm pleased to say. So again, the legislative shove isn't there, but we do have the public health outcomes framework, and we do have public health duties to respond to challenges that we have that are impacting the population wide. And that's where I've really grasped onto to help us take forward the argument to keep doing more in this space locally. We have worked really hard with our strategies, policies and plans to embed clean air. An example of this really is the latest corporate plan, which was published this year, really stripped back and cut out a lot of words, really focused down. I'm very happy to say we have all those listed things on there that show that actually delivering around air quality, and particularly for schools and young people, is ticking lots of those boxes. And if I go back to the last point, which I'm trying to cover, which is partnerships, delivering more, we can deliver more if we're in partnership. So we've worked hard with our corporate plan. Please say it also has the specific words cleaner air in there, which is really nice. We've also got cleaner air integrated into the Sustainable Hertfordshire strategy, where it's seen as one of 3 cross-cutting themes across all service areas. So all service areas across the council should be thinking about the air that we breathe, the pollutants they may be creating. And finally, we've got an air quality strategy. Hopefully in future, we'll be calling that a healthier air strategy. That's currently in draft stage and just gone out into the public domain this week, actually. And I'll be presenting to members on Monday to move that forwards. What we've done there is take our old strategy and refresh it with all the updated information we have, which is pointing us at doing things in the internal space as well as the external space. So that's an added focus in this revised strategy. We're also trying to make sure that we're looking at all of the air. So we're not just looking at the prescribed air pollutants that are designated in the local air quality management regime. We're going to be thinking about everything, including biologicals. The idea there is it brings us closer to health partners. It stops any disconnect if we're thinking about measures to take out or protect us from infectious diseases in an internal space. Let's not forget there's other nasties that are there, the air pollutants, and what can we do that tackles both at the same time? The strategy is designed to do that. And we're also promoting in the revised strategy going beyond legal standards. I've actually had a contact from DEFRA today just to say, oh, we hear that you might be doing this. It'd be useful to see what you're planning. So there seems to be interest around this. This is designed to enable us to keep pushing further in future without those legal standards being breached locally. So what have we actually been doing? Well, one of our projects that we've been doing in schools is around putting air purifiers in, HEPA filters into schools. We worked very closely with SAMI colleagues who donated the monitors and have done some really good evaluation work for us. And we have 62 schools signed up to the project as of last September. There are 29 of them with an air quality monitor in each classroom as well, but each of those 62 schools has an air purifier in the classroom. And Sam Woods, I'm not sure if he's in the seminar listening, has done some really great research around this, pulled the data together and shown that we're having quite a significant impact on particulates within those classrooms, about 30% reduction on average, which is fantastic when you consider that we know that some of those school classrooms might not even be using them, but they'll be counted in the data. We made this hard for us to do because we didn't just look at, well, could do any schools because all young people are more at risk group. Actually, we know that more deprived areas are more at risk as well. Sorry, skip back up to this previous slide. So the red areas that you can see are more deprived, and you can see the blobs where we put the blue and purple blobs basically on this map. We've got down here, for instance, mainly in the red areas. They are areas where it's historically maybe harder to engage because it's more deprived areas, but we made a point of targeting these areas because that's where we feel we could create the biggest health impact. If I just show you this slide now, which gives you the particulates picture, you can probably, if you know the area, you can see where the M25 is and where the A1 is and the A10 is. We've focused very much where there is more pollution as well in the external environment. And the research that was done, that Sam did, showed that actually that was the right thing to do, because where you've got higher outdoor pollution and higher overall concentrations, the particulate monitors are working best. They're reducing the total concentration by more. I'm very happy to say that our engagement with partners enabled us to then move on and have poster presentations. We've got bits out into national press. We also helped to put out the cheaper tool, so a tool that all schools could go and access online now to see what the impact of providing HEPA filters in their space would be. We're also doing lots more on schools, but I'm not going to bore you with that today. Maybe come back at a later date to talk about the other bits and pieces. And then final slide on partnerships. I've just listed some of the partners here. You'll be aware of some of these. So Chili Hub's on there. We've already been working with Chili Hub to do things and looking at how it might be possible to get, for instance, external monitors onto schools. Working some of the related networks that are in there, some of the micro network pluses, which will have a crossover maybe with Inhabit as well. And you can see what we've been doing is building this network of places where we can go to capture good data so that I can inform councillors who are our decision makers, because they're the ones that effectively say, should we have a focus there? And if we should have a focus, is it going to come with any money to do things? So the knowledge I've gained from talking to the academic realm has given me that confidence and information to go forward and really set us up off a strong footing. And then we've tapped into the ability to take opportunities with these networks and hubs and think about grant proposals to do good things here in Hertfordshire. UK 100 just on the bottom there watch this space for this year and cleaner air work going on, because the idea is there should be something happening there, and it might be interest to this group as well. And that's all from me. Thanks for having me, folks. Happy to take any questions.
That's great, Matt. Thank you for that. And yeah, really nice to see the engagement in there as well, and the breadth of that engagement. Can I just ask you on that one? I mean, I know you've been linked in with some of this community for quite some time now, but how easy have you found it to engage with the research community? And perhaps I shouldn't ask that. I don't know.
No, I would say that if I went back 5 years, I'd probably say I was struggling. But I think partly that was because of my own knowledge and contacts at that point, making personal connections, take things forward. But also I think probably if we go back 5 years, 6 years, we were at the start of the Clean Air Programme, the SPF work. And I think that work has really driven quite a tight-knit community in the air quality space. And that then after a few years of bugging the likes of Stephen Holgate, Gary Fuller and Suzanne to say, hey, what about this, what about that, what about the other? Getting invited into that forum then opened up a lot more doors as well, enabled me to come and speak to some of you guys up and down the country at events that have been taking place. And so that's created a real opportunity for me. And now we've got that, I think, that stronger network, and it's starting to look at those partners and realizing that when research calls are coming up, they're asking for partners. They want local authorities there. We're more useful maybe as local authorities, but equally I think you guys are now more accessible to local authorities, I would say. So I think there's been real work in this area, and we are stronger now than we were 5 years ago. And hello, lovely little cat that's just appeared.
Yeah, I've got my co-chair has just joined me. He's not been very active throughout most of this, to be honest. I've got a question here from Jonathan, which is around, which I guess is to you, but also perhaps some of the others might comment on this as well. Have people seen suggestions that shifting the language we use towards pollution rather than clean or safe air could highlight the urgency of the issue? And what are your thoughts around that?
Yeah, it's a really interesting one, because if I went back and go, I'm an environmental health person, really. When I go back to my starting off learning in that space, we always talked about air pollution. That was our standard language. Environmental health people talked about air pollution. Public health people talked about air quality. And sometimes you could be talking about the same thing and not know it, because you could search documents for, has air pollution come up? Yeah, or pollution come up? No, it hasn't. Air quality might have been in there then. So there was a bit of a disconnect. I think I've tried to mold things together to talk more about air quality, and since then cleaner air, and then taking a further step forward with the new strategy to talk about healthier air. Now that is for very specific strategic reasons of looking to bring us closer to health partners, so NHS colleagues, ICS colleagues. But I do appreciate the debate and discussion that goes on around language, but I would suggest it's horses for courses, and that air pollution may be a really useful term to use sometimes, but other terms equally as fitting. It's depending what you're trying to do, how sensitive the issue may be in your area, how much support politically or from decision makers you have or don't have, and all of these things will shape the language which we use to get. Basically, it's about getting good things done, and I think we have to mould our language and not be set on one term, otherwise it can make us fall down occasionally.
That's great. Yeah, and I guess just as a follow-on from that, when you've engaged with schools a great deal over the past few years, but you've obviously engaged in environmental health with many other organisations across Hertfordshire. Have you found that the language and ways of describing things, or the ways of engaging, are different with schools to any other environments?
It's a good question. I think that if we were talking about engaging young people specifically, I mean, Michaela's probably better to speak on this point than me, but certainly you'd change your language. no doubt about it, you change your language. But actually, for me, that's really important thing to look at average reading age of our general public as well. And actually, if you're aiming at talking to children, actually, that's probably quite apt for messages that you're putting out to the wider world as well. You've probably pitched the reading age correctly. So there's that aspect, but there is a challenge around this, because if you're thinking, I might have to, as a local authority, have a briefing note to put something forwards, I might need to put that forward to senior officers. They might have a good bit of information. I then might need to pitch it to members who may or may not have as much information, because they might be newly elected, or they might have been there for a while and carried the portfolio. You then might be talking to the public or subsections within that public, or going to talk to your ICS colleagues. And all these audiences use a slightly different language. One briefing note might not cut it. You've probably got 4. And that's a bit of welcome to our world there, isn't it? Of like, we need to tailor those messages very specifically.
Yeah, that's great. And actually, I think that's, another part of the benefits of working in partnership with people like yourself is to make, help the research community tailor those messages effectively as well, because there's plenty of times, I'm sure, where we'll say something and you might go, yeah, but what do you really mean by that? And I think I think it's something that we can all learn to do better as well.
It's my one question which I always put back, and I always say to folks give me brilliant presentation or events, wonderful work explaining 5 years of their life, and I always say, that's great, but I'm a local authority person. What's the so what question that I ask? What's the answer to the so what? Meaning, that research is brilliant, it's got so much in it, but what can I easily pick out which helps me do a good thing with it? How do we translate it from a research academic realm, scientifically written paper, into putting it in front of a decision maker who says, do you know what, we really need to do better for our ventilation systems in schools. We're going to insist that our designers do better in this space in future, as an example.
That's great. Thank you for that, Matt. So I think that brings us to the end of today. I want to say a really big thank you to all of our speakers today. Some fantastic talks there, and really showcasing that breadth of the science, or well, actually even just scratching the surface onto the breadth of the science and engagement and interactions that are going to go into Chile, and obviously the work that is going to be that's been carried out already that will feed into this. And I've just seen a question from Debbie here about whether the outputs of Chile will be fed into organisations carrying out the retrofit of schools. I really hope that we will be able to do that, and we'll be able to engage effectively across the community to get our outputs to the places they need to be and the people that they need to be with. But not just do that, but also work directly with people and help engage and co-create as we go through the whole programme. I'd just like to say thank you to all of our speakers. Thank you to the Chile team, and particularly Lillian for setting up the seminar for us today. We are hoping this will be the first of a series of many really interesting seminars over the course of Chile. Our next seminar, date for your diary, 23rd of March at 12 o'clock. And that will be delivered by Dr. Abigail Whitehouse, who's an expert in children's environmental health, who's at Queen Mary's University of London. So we will be sending stuff out. Watch out for the invite, but that's a date now for your diary. And yeah, again, I thank you very much to everybody for attending today, and I hope that it was enjoyable and interesting for you all. Thank you all, and goodbye.